Hi again. My name is Lennox Hoyte, MD. I'm a fellowship-trained urogynecologist and pelvic surgeon. We're going to talk today about a stitch in time. And usually as a gynecologist, a urogynecologist, we treat non-obstetric conditions. One of the ones that is obstetrically related that we do treat here at the Pelvic Floor Institute is recurrent pregnancy loss due to painless cervical dilatation. And so we're talking about what's called a cerclage procedure, which is a stitch that we can place around the cervix to prevent recurring pregnancy loss in women who are at risk for recurrent pregnancy loss. So in those women that have that problem, and you're properly diagnosed by your high-risk OB doctor or your obstetrician as having recurrent pregnancy loss without any other genetic or anatomic conditions that are leading to this, you can come see us at the Pelvic Floor Institute and we'll be happy to evaluate you for placement of a robotic abdominal cerclage, which is known to be the gold standard for treating recurrent miscarriage. Now, cerclage has an interesting history. It actually means hoop. The word cerclage is a French word that's derived from the word hoop or loop, which is back in the days when they made barrels, they would put a metal band around the barrel sheaths to hold the barrel together, and that's called a hoop or a loop. So the cerclage is a very similar device that goes around. And it was first reported in the 1950s by Dr. Shirodkar and soon after by Dr. McDonald as a device for rescuing the weak cervix that prematurely dilated in women who were at risk for premature childbirth. So that cerclage was a stitch placed around the cervix, placed through the vagina, and usually associated with the placement was the fact that the miscarriage was already beginning to happen. Those work reasonably well from time to time. They often don't work. And we think the reason why they don't work very well is because by the time the cervix has started to dilate, that usually meant that there's an inflammatory process that's happening with the amniotic membranes, the pregnancy membranes, that's causing the cervix to dilate based on a set of biochemical chain reactions. So what was developed instead was an abdominally placed cerclage for women with recurrent pregnancy loss that's placed preemptively. So it's placed earlier in the pregnancy before the inflammation happens to the membranes, and it's designed to tighten the cervix and hold the cervix shut so that the natural cervical mucus can protect the amniotic membranes from the vaginal inflammatory contents. Finally, the original abdominal cerclages were placed through a large incision in the abdomen in the pregnant uterus. And in the pregnant uterus, the blood supply can increase by up to 50%, sometimes even more, and so it was a bloody mess. Over time, that cerclage stitch procedure was developed into a laparoscopically placed procedure, minimally invasive. And what we did here at the Pelvic Floor Institute is we pioneered the robotic cerclage, which could be placed in the pregnant uterus before the miscarriage event started to happen, and such that the stitch can tighten around the cervix and close off the cervix to prevent the vaginal inflammatory agents from getting to the amniotic membrane. Our robotic cerclage from the Pelvic Floor Institute, we call it the Hoyte-Johnson-Weitman cerclage, named after myself and the early high-risk obstetrician, the late Dr. Valerie Weitman, who worked with me to develop that procedure, is very successful, it's very quick, and it's very safe, and it has had excellent results over time. Dr. Weitman and I performed that cerclage procedure many years ago for the first time ever at Tampa General Hospital here in Tampa Bay, which is the preferred site that we operate for that procedure here in Tampa Bay. It's really successful, it's quick, and it's very effective. We see women from around the country, around the United States and around the world who have need for our cerclage procedure. And we're happy to see you here at the Pelvic Floor Institute if you're interested in having us treat your recurrent pregnancy loss due to painless cervical dilation. Please do like and subscribe. If you have any questions, please put them in the comments. We'll try to answer as many of them as we can. Thank you so much for watching. I'm Dr. Lennox Hoyte, fellowship-trained urogynecologist and pelvic surgeon, and we were just talking about the robotic abdominal cerclage placed for recurrent pregnancy loss due to painless cervical dilatation. So traditionally, abdominal cerclages have been placed using a large incision in the abdomen to locate the cervix and to place a stitch around the cervix and tighten it in a way that the cervix is constricted so it doesn't dilate prematurely. In more modern times, cerclages have been placed appropriately using laparoscopic and robotic techniques, which are minimally invasive techniques, which have become really very good at helping the practitioner locate the cervix and place a stitch, usually a Merceline stitch, around the cervix to prevent it from dilating prematurely and to isolate the endometrial contents from the vaginal contents and minimize the risk of inflammatory triggers to premature labor. So when you look at minimally invasive techniques for placing the cerclage, one is a traditional laparoscopic technique, and the other technique is a robotic technique, which involves the same technique as laparoscopy, but the robot allows for more degrees of freedom that allow the practitioner a more realistic access to the tissues that need to be addressed when the cerclage is placed.